Will giving birth cause hemorrhoids? Pregnancy and childbirth are major factors that cause hemorrhoids in expecting and new mothers. In this video, we will cover the relationship between hemorrhoids and childbirth and the steps you can take to treat and prevent flare-ups. If you suffer from severe hemorrhoid pain, then check out Hemrid, a powerful, all-natural hemorrhoid supplement that can target hemorrhoids. For more information, check out www.hemrid.com. Pregnancy and childbirth can contribute to painful hemorrhoid flare-ups. And, in fact, women who are new mothers or are expecting make up a major group of hemorrhoid sufferers. A growing fetus can cause pressure on the lower rectal veins. The sensitive network of arteries, blood vessels, and smooth rectal muscles are not used to the added weight. As a result, the veins are constricted and swell, causing hemorrhoids. Childbirth, similarly, involves extended periods of straining in an effort to deliver the baby. Straining is a contributing factor of hemorrhoids. Postpartum women often deal with severely painful cases of hemorrhoids following their deliveries, especially vaginal deliveries. Hemorrhoids may be a frequent issue during pregnancy and childbirth, but the condition is by no means permanent. Flare-ups come and go, and there are ways to curb their occurrences. Pregnancy often causes constipation and straining on the toilet. Eating more fiber or taking fiber supplement based on your doctor's recommendation can be helpful. Hemrid contains fiber supplements for hemorrhoids. For most women, hemorrhoids that form after childbirth are unavoidable, but that doesn't mean they are untreatable. Trying these solutions can aid in relieving the most painful of hemorrhoid symptoms. Applying an ice pack, taking a warm sitz bath, using medicated wipes, applying balms, ointments, and topical treatments, using a hemorrhoid suppository, using a fiber supplement. Want real relief from hemorrhoids? Go to www.hemrid.com to learn more.